Welcome to another episode of Empower Speaks Healthcare Talks. We have a very special episode today. So, as always, I'll start off with a bit of background information about what Empower Speaks Healthcare Talks is, and then I'll share why today is a special episode. So, as the name suggests, it's the idea to empower and within the healthcare ecosystem specifically. So we have these conversations with various guests and we bring various stakeholders within the healthcare ecosystem, whether it is entrepreneurs, patients, senior leadership within the healthcare ecosystem, or clinicians, you name it, so we can kind of dissect their brains and ask them about some challenges, various aspects of healthcare, so you can better understand and in turn navigate the healthcare system. And right, the way to empower is through knowledge dissemination, and that is why we have these conversations. And the reason that this episode is so special is because it's in partnership with the University of Toronto for their FHLIP Conference, which is the Future of Health, Leadership, Informatics, and Policy Conference. And so what better way to disseminate knowledge than through a conference? And so that's why this partnership is so incredible and powerful. And so before the conference happens, we wanted to give you a taste of the speakers and the conversations that will be happening. And so today we have a very special guest, Dr. Abbas Zavar, who is a faculty member at the University of Toronto. So we're going to ask him various questions to understand the purpose of FHLIP and also kind of dive into some topics that may be of interest to you. So Abbas, welcome to our podcast session today.
Yeah, hi, Fahreen. Thanks. I really appreciate it, and thanks for having me.
Yeah, no, absolutely. So we're going to start our session very basic, and we're going to dive into the FHLIP conference. You've been part of it, and we've all been part of it since the inception of it 3 years ago. And so kind of wanted to ask you, what was the purpose of starting the FHLIP conference? And then also, kind of adding on to that, how has it evolved to the third year, which is going to be this year? So yeah, please take it away.
Yeah, sure. Yeah, so as you said, we are all part of the MHI program at Startup Health Informatics, and I'm also an alumni. And when I supporting our program director, Dr. Karim Shabji, for a new strategy of the enhancing the program, so we came up that we need to have an event with the students, with faculty, to present what our students are working as a project, their ideas, and how they are supporting by faculties, and make more announcement, and also how engage external our program stakeholders with our students project. So we came up. The conference is a good uh, environment. We came up for the first time, and as we are under IHPME Institute, so we focus on health informatics, leadership, and policy main component because we are working on that umbrella. So with that reason, FHLIP conference came up, and we started our first year, 2024, and what we just wanted to kind of be different with other health informatics or digital health conferences, because they are great, they are fantastic. I love them. I usually attend all of them, but they are more focused on vendor or business perspective. Their presentation, all discussion, it's maybe more technical or vendor based or business based. We just want to add more academic aspect to that conferences, make it more involved with the students, academics, and also bring in leaders, thought leaders, and policymakers of health informatics under one room, and to make it more engaged.
Yeah. No, I think that's so beautiful, like you said, being on the academic side to give that platform for students. I also am an alumni of the Master of Health Informatics program at the University of Toronto, so I agree. We've kind of seen that evolve, and I think it's such a great platform to bring the students. They're heavily involved. Some of them are presenting. It's a great platform for them to build their credibility, starting off their careers and all that. So I think it's, as an institution, it's a great initiative and a great platform. And then the other piece that you said involving various stakeholders. we've been very conscious of including patients. Even in our discussions earlier, we made sure we allocated seats to patients to have them at the table. And I think that's so important because I always say this, and I sound like a broken record, but we're all patients. It doesn't matter your title, it doesn't matter your profession.
It's,
We're all
yeah,
patients at the end of the day. Maybe not today, but we've been in the past or a loved one, and we may be in the future. And so it's always important to keep that in mind when we talk about it. And when you said about the various stakeholders, like you said, we have, individuals from the government side, the hospital side, home care side, academic side, even the vendor side, right? We also have an exciting startup zone as well that we've included this year. So I think to your point, it's such a great platform to bring everyone together. Now, since you've been part of it since the inception, do you mind kind of explaining how it's evolved? So from 2024, the very first year that flip occurred, how have you seen it evolve, especially now to the third year? What have you seen that's kind of changed, was kind of stayed the same? What you're kind of like, okay, these are, key pieces that we've changed this third year, or key pieces that you think are good to highlight for the audience? Yeah.
yeah, sure. Yeah, gradually because we have a good understanding of who are the stakeholders can support not only MHI students, all health informatics or digital health students or program, who can they support them specifically from leadership and policy making. So in that way, each year we are enhancing our approaches. Right now in FLIP 2026, we engage all major national and provincial organizations. We are very thought leaderships organizations, Ontario MD, AMS, CEP, CARHI, Canada Health Info Web, name it. So all of them is very fantastic support for our program, different perspective. They are supporting us as a scientific committee members, as a sponsors, as a mentors for our project. Many of them, they join to our program as a mentor or faculty. So we want to make this uh, two-end collaborations in different way. So this is one perspective. The other one, as you mentioned, we bring in a startup zone. We have invited all universities, TMU, McMaster, Waterloo, their program director or faculty. They are also part of our scientific members. And many of those students, they apply for submit something for presentation. So it's very full engage all communities, Canadian communities. We also we had two submission out of Canada this year. That sounds great, but our main point is we want to connect all thought leadership in health informatics leadership and policy making with our students and faculty in one room. It doesn't matter. We are the host, MHR program and University of Toronto. We are the host, but we want to engage all of those in this event.
No, and I think that's so beautiful how you mentioned that, like, even the Flip conference itself is an ecosystem for everyone. Like you said, bringing students from various, not just the University of Toronto, all across Canada. And how you mentioned, even from a government perspective, not just, provincially, but also federally, like trying to include everyone. So you have everyone at the table. And I think that's kind of been, to your point earlier, one of the biggest pieces of the Flip conference, where we make sure all, as best as we can, all the stakeholders have a seat at the table, because the first step is having conversations and discussions. And so I think also incorporating, being very intentional about students, because they're the future. As we get more seasoned, we will need our students to keep, come after us, and to keep moving and have that momentum. And so I think it's a great way to launch them into the space, build those networks, as they will, once they graduate, they will also be part of the eco. They already are, but they will be more on the other side of the table, right? So I think that's so important. Now, the next question I have is, Now more about the theme. So this year is about silos to synergies. If you could dive a little bit of what that theme even means, how's that going to be presented within the various conversations, the panels, you name it, that's happening within the conference, or even within that larger overarching theme? Are there other themes that fall under that some of the audience members can keep a lookout for, or things that you are looking out for in terms of themes that have been categorized, whether it's papers, talks, panels, you name it? So I'll hand it over to you in terms of the themes aspect of it.
Yeah, sure. So, as you mentioned, this year theme is silos to synergy, or in simple word, in one word, is interoperability. We know that we have a fantastic digital health and health informatics enhancement in Canada, all internationally or provincially. But also we know that how big issue we have in this system. As my ideal version system as personalized medicine approach, I really love to talk about it maybe later. So uh, for have an advanced healthcare system with all of those digital health and health informatics perspective, interoperability is the bottleneck right now, and suffering all systems, national, provincial, or private level. So we selected this one, and we invited people from academic perspective, and also involve all organizations, not only as a submit and presenters, as our panelists, as our scientific chair, as a high level of province government in Ontario, Angela Copeland, and our opening keynote speaker, Daphna Kerr. So there are fantastic thought leaders in this field, and we want to involve all of this presenters, panelists, attendees, all to think about it. What would be the solution on interoperability? And it's, as I said, it's kind of different with other conferences. Maybe they are talking more technical or presenting what are solutions to bridging lack of interoperability. But here we are talking about what the strategy, what new policy making is required, how leadership can resolve any of this issue. So kind of we are see this issue from different perspective, and I'm sure that attendees will enjoy from our presentations and also keynote speakers and closing panel. I really look forward to it.
Yeah, no, absolutely. And in terms of choosing this theme, like silos to synergies, and like you said, it's more about interoperability for audience members that maybe not be as familiar with what interoperability is. Do you mind diving into what it, in simple terms, like kind of how you explained it earlier, what it essentially is and why it's such an important topic that we've kind of had this whole this year's conference around this entire team? Do you mind just explaining it to our audience members?
Yeah, sure. So it's simple. Silos to synergy. Silos. We are at that level in Canada, or maybe other globally. We adopted, implemented lots of advanced technology in our system, hospitals, any clinics, any laboratories. We have lots of fantastic digital solutions to gather information, generate information, but there are silos. They are not connected, because the main problem is their system, they are talking in different languages, kind of the easiest way to explain it. So if we want to have a cohesion system, all systems should be talking same language. So data standard, privacy, security, all of those foundation of data sharing, all of them are subcomponent on interoperability. So we need to consider how we can make bridge, because our full term definition of this year conference theme is silos to synergy, make bridges. So we want to discuss how we can make those bridges to make a cohesion and a full connected and integrated system in healthcare system.
Yeah, no, I appreciate you sharing that with the audience. Just for those of you that are, might be interested in attending, like this is the reason it's such a big part and important to address in our healthcare ecosystem. Because even us as patients, right? Sometimes we're based in Ontario, you can travel out British Columbia, and they will not have access to your data, and so they will repeat tests. That's costly, that's timely, all of that, and so to your point, it's such an overarching important topic. And by starting these conversations at the FHLIP conference, I think, there's talks about it, but actually addressing it and having everyone at the table to initiate it, I think is very important. Um, you will be presenting at the FHLIP conference. Do you mind just giving a little snippet to the audience of what what you'll be discussing with them, and just give them a taste of what they can look forward to based on the presentation you'll be giving?
Okay. I wanted to surprise them, but
A
but
little bit,
okay.
just a snippet, just to get them excited to join us. Yeah.
Uh, No, if they follow me, they easily can predict what I want to discuss because for years I'm following the personalized medicine vision, as I strongly believe this is the ideal version of healthcare system. Briefly, if our healthcare system provide the right clinical intervention that uh, might be diagnosis, treatment, or prevention at the right time for the right individual. This is the fantastic healthcare system, patient-centric, and whenever you need the customized, personalized healthcare services provide. So, but for achieving this fantastic or ideal approach or holistic approach, we need to solve many issues. One of them is interoperability, because for personalized medicine, we need to collect all data. It's not only health data. It's not only my family doctors and all of my hospital admission. It's all my lab, all pharmacy information. This is one component. We have 5 components of data under this umbrella. About omics, the most famous is genomics, proteomics, metabolomics. On lifestyle, about my sleep pattern, my diet, my activity, my social and mental uh, behaviors, environmental, occupational, social determinant of health. We should collect all of them, then we can provide a personalized approach for that. Definitely, the basic of this is interoperability. We should have access to all of these silos currently and collect all of them, put in one system to offer. And the second one would be AI. It's huge data, and without AI, definitely we can make that personalized medicine approach. And as prevention is always my most favorite topic, so you will learn about my recent project about personalized prevention plan that we funded by Canada Health Infoway, and we want to present the results of our phase 1, what we have done.
No, that's so exciting. So hopefully like everyone in the audience is kind of pumped up about that. And I think it's incredible. Just to reflect back, so when we say personalized medicine, because a lot of times we use these terminologies and to make sure that we are understanding. So basically, the treatment plan or have you very personalized to me as an individual. So like you said, through interoperability, through AI, having access to all my data. So like you said, not just my physical data when it comes to mental, my genomics, my history, my social determinants of health, like me as a whole picture, using that to be like, okay, Fahreen is X age, she has this previous condition, she's allergic to X, Y, and Z, so what makes sense for her? Is that what you mean when you say personalized medicine and using all of that? Yeah, just want to make sure that for the audience, what essentially that is that essentially what personalized medicine is, or are there other pieces of it that the audience should be cognizant of when they come to contact with this term, or when somebody is explaining it or speaking about it, so they know how to navigate those conversations?
Yeah, right now our approach in medicine is evidence-based medicine. So, and what means that most of the medical and clinical recommendation comes from a clinical trial. And that approach is we are looking for one size fits all. For example, if there is a new medication for asthma, we coming with this idea that this new spray can uh, resolve asthma attack or prevent it. Then we put it in two groups, two really similar groups, one as a main goal, the other one as a second group, as control group. We test it out, and if, for example, works for 85% of those, it's like, oh, this is fantastic solution, and we run it. Well, this is one fits for all. It's not personalized medicine. What about 15% that they don't get benefit from that new spray? Because they have different genomics, they have different ethnicity, they have different proteomics, their lifestyle, social determinant of health. So we need to come with a personalized approach to cover all 100% asthma patients. Maybe we need to change the dosage. Maybe need to add another medication. We may need to change the environment factor, something. So without having all of those information, we couldn't make it personalized. A simple example is that I heard from someone in McMaster when I interviewed for my project. They said that hospitals, they realized that in the summertime, they have some asthma attacks for different region in the same time. For example, in that neighborhood, that zone northeast of uh, uh, Hamilton, they coming to the emergency department on Wednesday. And the other zone, the majority, they coming on Tuesday, something. And they realize, okay, why? This is asthmatic. This is summer. There are lots of allergen, but why it's zone dependent? Then they realize that, okay, the city cutting grass in parks in that zone and make more allergen in the environment. You know, you need to know, then you can offer some personalized prevention approach. Okay, those people you are working down on because we know that this allergen is coming. So please don't go to the park for that day for exercise. Stay in home. This is personalized prevention. We need to collect all those data, then we can customize our approach.
Okay, no, I appreciate.
Sorry, I can talk a lot about personalization.
No, that's amazing. Like, and I appreciate you doing that because it helps to understand what it is. Because we hear these terminologies, and we'll try to simplify it in our own minds. Like, okay, personalized, okay, personal to me. But what does that mean? I appreciate you providing those examples because that kind of helps understand that. And the example you gave, like for example, asthma, a spray or what have you, they'll test it out, and it works with 85% of the patient group, but the 15% it does not work for. And like you said, you may have to tweak the dosage or what have you. Do you think that 15% that we don't necessarily account for, or we kind of make it a one size fit all, that's who ends up in the ER? And then because we miss those, because right. So do you think that that's where, so we can, it's all kind of like looped in together. If we're cognizant of that 15% that we miss, personalized medicine will be, like you said, be able to catch it differently so they don't present in the ER. Is that kind of what you think too, that the parts that we miss is what ends up presenting in the hospital, and then that's where and it has a ripple effect to the healthcare system. Any thoughts on that?
Yep, might see, as I mentioned, there are many factors that are affecting our system and make our system is not fully effective. So when we can collect all that data and personalize it, so then our system be more effective. This US company, and the only EMR that so far I found globally, maybe there are some, but I don't know. They have fantastic EMR system that, because they are including genomics, DNA analysis, and also most updated pharmacogenomics to their EMR. So at the point of care, as a physician, when I want to prescribe a new medication, for example, a new antidepressant, the EMR engine behind of this would be AI, offer the for example, we have a big list of antidepressant, top 10, for example. Uh, the system suggests me only for this patient, these three are the best. The other two you should use by caution, and the last five is contraindicated for only this patient because of genomics and match pharmacogenomics. So when I don't have this information, I should um, uh, rely and trust my knowledge or reach out to guidelines to find what would be the best. But the system provides me personalized medication at the point of care. And when we have this kind of approach in clinics, as you said, the system would be more effective and maybe we can bring down the burden on emergency department.
No, I appreciate. So I think to your point, I was still looking at it from a single lens where I was like, okay, the medication will miss the 15%. But where you saying that's a part of it. But like you said, where the grass being cut, so other pieces to make it more holistic, we need to be cognizant of to be able to cater and personalize it to the various patients. The piece where you said that you would have AI in the background, if possible, to kind of share what that means. If it dives into your paper, I want to be mindful of that because don't want to give away everything. So the audience members do attend and kind of get a taste of it. But if you could explain in with interoperability, having access to all those data points, where does AI come into that larger picture?
Yeah, AI definitely can make many roles in sorry in that matter. Not only right now there are lots of APIs help us. As I said, we have lots of different data standards in our system. We can call it different language. So we need a system to translate one language to the other language or one data standard to the other data standard. So right now, lots of AI solutions do it quickly with high quality and accurate transfer or transform data standard. This is one aspect. The other one to collect data, to de-identify data, to normalize data, to how we solve it, missing data. AI is a fantastic solution for it. And then for data linkage, we have hospital data, we have family or family physician, we have pharmacy, we have a smartwatch, we have wearables, remote patient management, we have survey online. All this data is coming, flowing to the system from perspective, personalized medicine perspective. How we can linkage all of this is about me. To test it out, we be sure that all this information and make it perfectly linked. Without AI, we can't make it. It's huge data. As an example, by 2025, only health data, not genomics, not lifestyle, environmental, social determinant of health, wearables, not all of that. Only health data, admit hospital and family or community-based clinician. We created almost 10,000 exabytes data globally. It means 10 with 19 zeros. So it's huge. Just one domain of personalized medicine. We have other 4 domains. So definitely AI is required to analyze this, review it, clean it, normalize it, data linkage, all of those data governance and data analysis.
I know. I appreciate you kind of sharing that. So that's exciting because we hear AI a lot. Sometimes it's a bit of a buzzword, right? Because we hear it so much. But appreciate you kind of explaining how it can be incorporated and can help with some of those things behind the scenes that we may not see, but are so important and to make it possible, essentially. One more question I'll ask about personalized medicine, and I promise we'll keep the rest as a surprise for the audience. Because you work, this is an area of your expertise and you're very passionate about it and working in it and in doing a lot of research in in that research, have you seen globally other areas are they a bit more advanced to where we are? Or are we kind of all on a global setting, kind of all in the same stage, trying to figure out how do we make personalized medicine a reality? Or in your own experience, have you seen somewhere else where you're like, oh, they've done it, so how can we learn from them? Or is it still very new that we're all still trying to work it out as a global healthcare system?
Yeah, sure. If we want to talk about the personalized medicine, um, yeah, there are lots of enhancements in other countries, specifically after, I believe it was 2015, after President Obama invested hugely on precision medicine. I really like to distinguish between these two, precision medicine and personalized medicine, because precision medicine is more focused on genomic section of personalized medicine and more focused only on treatment, because it's more available, and I believe more pharmaceuticals they are interested on that one. As I said, that for example, that EMR system at US, so it's more tangible because easily they can sequencing DNA, identify some markers, link it to disease, and test it out and find pharmacological to support it. So they are more tangible. But this is precision medicine, and we have huge advance on precision medicine. And recently with AI, we are very good at that point. You see that we have lots of new uh, medication and approaches to cure cancers or other diseases. It's coming from precision medicine, but we are mainly lack of uh, data collection, data generation, and data linkage for lifestyle, for wearables, for environmental, for occupational, for social determinant of health. So I have done 3 years ago a very comprehensive study, and we published it as a white paper. So exactly we investigated about all 5 data domains, what's happening in Ontario, and where is the gap. And we mapped it out. All of those are the gaps. So even we have a huge advantages on precision medicine, we have lots of lack of support for the other section. So it's kind of imbalance in our system, and hopefully we can catch.
Yeah, no, that's incredible. And thank you for kind of sharing all that with the audience. So, definitely, if you're interested in learning more, definitely sign up for the FHLIP Conference, which is going to be on February 20th, 2026, because you'll have a lot more. You'll get to learn more. We'll have so many other conversations that are, similar in different areas. So, that being said, this year, like you said, we have so many presentations, we have some panels, keynotes, we have the startup zone, we're going to have some live podcasting. What are you looking forward to out of all of that? Not to put you on the spot, and I know everything's going to be incredible, but maybe just some pieces or nuggets that you're excited about that you want to share with the audience so that maybe they could also keep a lookout for as well.
So totally, I'm looking for the Flip Conference 2026.
Safest
uh,
answer, everything.
almost I'm working on it for a year. So yeah, we did our best to make it happen. Definitely, I would like to see students, alumni, colleagues, friends from the community. They will join us. So the one I really like to be part of that is our opening speaker, Daphne Curry, is our new thought leader in Ontario. She's leading the digital health in Ministry of Health. So we are really interested on understand what are her plan and her recommendation to make bridges up between all these silos. And that will be moderated by Will Fall. He's my fantastic group. You will find all his fantastic posts and publications around all medias. You will enjoy about his thought, Then we have many presentation as you said, not only as students. This time we have many fantastic submissions from many new organizations around Canada. So that would be great. At noon, we have a new delivery of quick presentation, not as a traditional poster presentation. We have laptop talk. So all people in the same group, our students or our presenters, they will they present their quick discussion on their project. In parallel, we have our executive master students that they are presenting their national project with their faculties. And at the end, we have a fantastic panel. Again, we moderated, and we have great thought leaders that we will talk about call to action, what we need to do for better interoperability, and then we will welcome everybody to our reception. It would be lots of sponsors. This time we bring in many a startup zone. That would be a fantastic networking for everybody, specifically students.
Yeah, no, appreciate you kind of giving that breakdown. So there's so much happening in that day. So when you're attending, make sure to take a peek at the agenda to see what you want to, make sure you don't miss out on. As the boss mentioned, starting from the morning, the keynote, the conversations, the panel, and then even wrapping up the evening with that as well. And in between my presentations, laptop talks, you'll get to meet and see so many different things, the startup zone, you name it. And that being said, I think when you started off with the community, even for myself, sometimes that's the one time you see everybody that you haven't seen, because as you graduate, as you move on in life, things change. And so the FHLIP Conference is a great time where we get to meet people from our community, which maybe you didn't get to see until last year at the same conference. So I think that community piece is very important, and we're very intentional about that. So that being said, moving from that piece, one of the biggest terms and buzzwords we hear about is AI, artificial intelligence. And that's, we're in general in society where, I wouldn't say just concern, there's excitement, there's a bit of concern, there's a lot happening around that. So given that, within the FHLIP conference, how are we kind of incorporating AI is, in your thoughts on that to have it as a theme or underlying within the various presentations, conversations we have. So I'll first start off by asking you within the FHLIP conference with AI, and then I'll kind of branch off later with some additional questions on your thoughts. That too being a physician by background. So yes, please first let us know about FHLIP in terms of AI and how that's being incorporated for the audience to keep a lookout for.
Sure. So before that, I missed one fantastic other thing we have on our agenda. Maybe not explicitly, you can find our website on agenda, but this time we have a live podcasting by Fahreen. So all the time. So please find Fahreen in the second floor of my health center. So we will have a specific booth for live podcasting. So that would be another fantastic opportunity. And then for AI, for sure. So in all our last 3 years, AI was under our theme topics, and we have many presentations this year about it. But I don't want to really spoil that our next year theme, it would be more focused on AI.
Okay, no, that's awesome. So he's just giving us just a little taste and a snippet that there's more to come. Because to your point, I think there's so many conversations around that, and it's always been an underlying theme over the years since 3 years ago, 2024. Even one of the papers I presented on in that year was to do with AI. So to your point, I think it's evolved over time. I do appreciate the shout out for the live podcasting, so do definitely come check us out on the second floor. Building off of the AI piece, I wanted to ask you more. So, by background, you are a physician, and so as you see AI evolving, I know you're doing the research or what have you. There's a bit of excitement, but there's also a bit of fear, and that fear comes from loss of jobs. So based on your experience having that clinical background, how do you view AI? Do you view it as, is something exciting? Do you also, being very transparent about that job loss, as being a clinician? Do you mind just sharing your thoughts on that, or more in a general perspective, being a clinician by background, what you've seen and you are exposed to the AI space? Is there any tidbits or pieces or insight you would like to share with the audience, given your mixed and amazing background from both sides of it?
Sure. Yeah. So I love really AI, and in my full-time job in Ontario MD, I'm really involved with AI related project. I'm totally involved with those project. So first of all, I really like to emphasize that my definition, in my personal definition, is very aligned with whatever American Medical Association, they have a definition for AI. They don't say it artificial intelligence. They say it augmented intelligence. It means that we don't want to create a new AI replacing human AI. We are creating some new AI as augmenting human AI. So indeed, we want to create, as I mentioned, right now, one of the cause of burnout of our physicians is not only documentation or all of those stuff. They are the cause of burnout, but AI Scribe solved many of them, or AI Inbox is coming to some of all of them. But you consider that every 73 days, medical knowledge globally is doubling. It means that each physician, if they want to keep them updated, every 3 months, whatever they have learned, they should make it double. It's not possible. How these full booked physicians, super busy physicians or clinicians, nurses, can be upgraded every 3 months, double their knowledge. So AI should come in, find what they need, make a linkage, and based on all of those, we talk about ethical privacy, all of those, removing bias, removing hallucination AI, but bring the whatever physician need at the point of care for decision making. AI just offer it. Okay, this is for diabetes, for something, a new medication. This is the last guideline suggestion. This is what publications offering, and this is the suggestion. Final decision maker is still as a human, as a physician, based on their knowledge, based on their experience. But they need something support them to at that point of care. So this is that I'm expecting from AI. I don't see AI will replacing by physicians. I like that in another conferences, I believe it was E10, I forgot that. The speaker said that we don't need AI. Humans are great in medicine. We just need help to reduce burnout. So we are great. And currently I'm doing my AI fellowship at the University of Toronto, supported by AMS Healthcare. I really appreciate them. But it's exactly about AI and compassionate care. AI couldn't be compassionate or creative or provide compassionate. This is unhuman. But we need some AI support to help us to offer that compassionate and compassionate care indeed.
No, I appreciate you kind of explaining that. And I think to your point, it's meant to augment workflows. I think there's a lot of fear around that. So I appreciate you kind of explaining that. And the piece where you said, like, right now we have medical AI scribes that help with documentation to alleviate that because there's a lot of administrative burden. You said, if I'm not mistaken, AI inboxes. If I caught that correctly, what is that referring to?
AI inbox manager or AI inbox assistant, because the other cause of burnout is uh, specifically community-based clinicians or community clinics, sorry, they are receiving over hundreds incoming document to their EMR every day, each physician. So there are lots of duplications. Uh, Somehow they need to label them, triage them, what is the priorities, and that makes a lot of time for clinicians or for admin team to manage this. So now we have some new AI solutions. By receiving this document, they are reviewing those documents, and based on what clinics define, they label it. This is a lab test result. This is a specialist consulting report, and which one is normal, abnormal, or I should flag it as a urgent review. So AI organize the messy inbox or remove duplication, triplications. Currently, for example, one result is coming directly from hospital, lab test, lab, and also anterior MD HRN system. This is only one way direction from hospital to family physicians. So maybe one result is coming from all those three. So it's duplication. An AI inbox assistant identify it. So and merge all those three. This is one document coming from three sources. So this is a new solutions, but we have lack of interoperability because they need a full integration with EMR system, and that would be a challenge, right?
Okay, so just reflecting back, so the use of AI here, is this considered like agentic AI, so AI agents that are doing this? And so when you say the lack of interoperability, so they receive all this influx of documentation, but to act accordingly, it's not like the EMRs in the community are not connected with the hospital, or is that what you mean, where that lack of interoperability prevents even the AI agent from doing the full response to it because it's not connected? Is that what you mean, where the lack of interoperability can impact it being, used to its full maximum, or what did you mean by that?
Indeed, AI inbox assistants, they need a full integration. It means that they need to fully sit in EMR system because whatever all documents from different channels is coming, they should have access to it. Then they label it. They identify this document is related to me. So they need to have access to all patient lists on that EMR and label that document. This is for Abbas Zavar. This is the code. And if this is a normal, for example, lab test result, just attach to my profile, or if it's a renewal, just match it with pharmacy renewal, put the next step, route it to admin or route it to nurse or physicians. All of those, it should be happen in EMR, or even scheduling or something may be required. For that reason, AI inbox assistant need to be fully integrated with AI. And AI scribe adoption success because we are all excited about, wow, AI scribe solve many problems because it needs the less AI, EMR integration. It's a solo solution, understand the conversation between patient and physician, make a note, and physician just copy and paste in the EMR. Some of them are integrated right now, but because it's the less requirement of integration, adoption was very successful. But for other solution, maybe a little challenging of EMR integration.
Yeah, no, I appreciate kind of explaining that now. Now I'm able to see the full picture where AI scribes, it's a specific area that's integrated in and it does a specific task. Like you're saying, the AI inbox or what have you, those tools need to be integrated fully with all aspects of the EMR to be used to their maximum. So no, that makes sense. Now, kind of flipping the switch on the patient side, we talked about AI from the clinician side or even the admin side, how to augment their workflows. In your opinion, with AI now in society, do you feel that it will empower patients? Do you feel like with social determinants of health, it may, increase that gap in terms of equity and all of that? What are your thoughts of AI in the sense of patients or them even using chat or what have you to understand their tests and all that? So just wanted to gather your thoughts and your insight on the patient side when it comes to AI, whether it'll empower them, whether it may bridge the gap, may make a bigger gap. Yeah, just any thoughts in that regard from a patient side.
Yeah, that's a great. Overall, I believe that would be also not only beneficial for clinicians, that would be definitely beneficial for patients. Let's be no concern about privacy or ethical perspective. So, because that would be concern for both sides. But patient right now, they are maybe more than happy than physicians by using AI scribe. Why? Because before that, physician all the time in the conversation or during the visit, they just look at the monitor and play with keyboard, just documenting everything they are talking with patient. Right now, both of them are happy, the same as before, face to face. They are laughing, talking, and physician, they not concerned. There is assistant there taking notes, provide a soap note at the end, and patient, they are more happy because this is a compassionate care. They receive face to face, better communication with their physicians or clinicians. So they are more happy. Uh, than before. For other thing or recently even some patient scribe solution coming because maybe they need to record or that conversation for themselves and receive, okay, what would be the next step for me? What physician recommended? What I need to do for follow the physician recommendation? uh, Patient education, lots of AI solution offering after that visit or even scribes. They're offering what would be the next step in simple steps, simple description, including patient education, and doctor can print it out or email to patient. Okay, whatever we discussed today, I send it out an email. You can follow my recommendation. So, or even maybe right now they are not full mature. AI, for example, we heard some disadvantages of people they consult with ChatGPT and receive wrong advice, and it's happened some worse things because their algorithm is not enough mature or set for AI. But there are some chats that they really align with AI, with clinics and patients perspective with higher accuracy, less bias, less hallucinations. So patient can have access to it to understand, okay, this what sign and symptoms that do I have? This is emergent. I should go to the emergency room. This is urgent. I can wait to call my physician by tomorrow. So that would be another aspect of AI. Well, lots many. I know that many patients right now, they give lab test result or even imaging, they get to the AI, okay, what's happening here? They receive some result. Even they are not 100% accurate, but we are moving to that.
Yeah, no, I appreciate kind of giving all those examples. So the piece where you said patient scribe, so there are like apps or what have you being created. So the patient, when they go into their appointment, they record. Okay, that's incredible to record the conversation. So I guess even with language barriers or what have you, um,
Exactly.
so it allows them to collect that. So if they didn't understand something during the conversation, or what they can that's beautiful. I
And
think that's a great way.
many of those also, as you said, they are live transcription. Even with different language with physician, they can use that app to live transcribe the language. Yeah.
'Cause that's such an important piece, right, where sometimes there's a language barrier and all of that, so being able to, kind of come over those hurdles or those barriers for so I think that's incredible, and I appreciate you kind of sharing that perspective and covering both the clinician side as well as the patient side. One piece you had mentioned is, as we were talking about, if we put aside like the privacy and all those pieces on the side, just to kind of loop that back in your opinion, in terms of whether it's regulation, cybersecurity, privacy, um, based on your experience and what you've seen, any insight on pieces we should be mindful of or cognizant of as we move ahead with AI, whether it's on an individual basis or an organization basis, just from the cybersecurity, privacy, governance side, if you have any tidbits that we should be mindful of specifically within healthcare as we move ahead with these new technologies, to make it a reality and be able to use it safely and effectively for our patients and clinicians.
Yeah, for sure. Indeed, it's not my how can I say it? It's my out of my expertise, indeed. But uh, we are in a good shape of that one at the moment. There are lots of new guardrail, new legislatives, new acts is coming for that one. I believe a couple of days ago, IPC, I forgot what it stands for, this, but it's a main organization for privacy in Canada. So they published some very great report on privacy about AI scribes. So there are lots of lack of knowledge. We are all learning about new AI solutions in the system. We have some concern about privacy and security and ethical, and some liability it's happening for clinicians. They are using AI. For example, AI clinical decision support. This is my favorite topic. So if a physician followed that recommendation, if it's wrong, all liability is on physician. So there are lots of concern about it, but all system we are learning, we are sharing, and I see there are lots of enhancement in that way. But this we just recently started using AI in our system, so more are coming.
Yeah, no, I completely agree with that. I think like that's one thing sometimes we forget. The AI is new for all of us. It's evolving and we're evolving with it. And like you said, we're learning, putting those guardrails, learning as we go to be mindful. And the piece where you said that um, uh, if, based on a clinical decision support system or an AI clinical decision support system, if it's wrong, that recommendation is wrong and the physician goes ahead with it, the liability is on them. And so I think, like you said, that's one piece to highlight as well, even because I've worked with medical AI scribes. So they do review the note, but they have to sign off. So if something is incorrect, it's their license. So I think also being mindful of that too, that to have that compassion and empathy towards our clinicians as well as we're introducing new tools, it's still their license. So that they're signing off on. So how do we make sure and build that confidence with them and on both sides of the table, make sure people are protected and all of that and using it in the safest, most ethical manner. So I appreciate you sharing that. We had a lot of conversations today about FHLIP, picking your brain a little bit about personalized medicine as well as thoughts about AI, just because it's so new and such a hot topic especially within healthcare and at large as well. As we wrap up, is there anything else that you wanted to share, whether about FHLIP or whether about personalized medicine or anything we talked about during the session, just to leave with the audience with before we wrap up for today? So I'll hand it over to you, Abbas, if there's anything you want to share with the audience with FHLIP or in general based on our conversation.
Yeah, thanks. I believe we discussed all those details. So myself, I really looking forward to the FHLIP conference. Lots of learning and discussion and networking will happen on that day. And I wanna really appreciate the big team of MHI students, volunteers, almost 16, 20 students. They organize this conference. I really appreciate all of them. Without them, it not make happen. So that would be a students lead organized conference indeed. So yeah, we are looking for that conference. and we will talk a lot about AI and personalized medicine. That's all.
Yeah, no, thank you so much. And I'll piggyback off of that too, that the students are working very closely with them too. I completely agree. They're all so incredible. They've done so much into making this a reality. So I definitely wanted to piggyback off of that and give a shout out to the students that have been so involved. And I think those of you in the audience, definitely if you're able to attend so you can see what the incredible work that, us of course, but the students to see what they've kind of put in and bring it to fruition. So I think that's incredible. And to your point, there's so much to look forward to at the conference. So if you haven't gotten your ticket, please do. And we'll make sure to link all of that so you're able to access it. And the conference is on February 20th, 2026. So once again, a big thank you to Dr. Abbas Zavar for taking the time and having this conversation to give you a taste of what you can look forward to at the FHLIP conference. If you have not already, please do subscribe to Empower Speak so you can always, get notified of these amazing conversations that we have to empower you and better navigate the healthcare system. And we hope to see you at at the FHLIP Conference 2026. And once again, a big, big thank you to Dr. Abbas Zavar. Thank you so much for joining us today.
Great. Thanks, Ray. I really appreciate it. It was my pleasure. Thanks for having me, and I hope to meet all of your audience there.
Absolutely. Thank you.